independent of how the patient gets to IVF, definitely improved technologies in the lab have helped us get our patients get pregnant more quickly. The most important improvements have been with the protocols that are used and the medications that are used, and getting the patient's ovaries to respond better with improved quality of eggs and then therefore embryos. So that's one piece, is how do we stimulate the ovaries. The other piece is what do we do with the embryos in the laboratory, and definitely there have been improvements in the media, the culture media that we grow the embryos in, and the incubators that we use to grow the embryos in, such that we can hold on to the embryos longer in the laboratory and really get a good assessment of which embryos are growing, and therefore which embryos are the ones that are the strongest and the ones that are most likely to give us that pregnancy that we're looking for. And then we can even go further, because we can now biopsy embryos and look and see, do these embryos have a normal number of chromosomes? And if they are chromosomally normal, then we're yet closer to finding that embryo that's going to be a healthy one. And because we've gotten so much better now at picking embryos that are most likely to get us that pregnancy, we're even recommending transferring fewer and fewer embryos. And with that, we really are partnering with a patient in getting them pregnant, but with a healthy pregnancy of 1, max 2 babies. Because really we want the pregnancy to be safe, we want the delivery to be safe. So typically 1 baby at a time is the healthiest way to get there. And finally, if you have some extra embryos, then we freeze them for you for the future. And the freezing techniques have really gotten much better as well. So freezing is a good way of preserving those extra embryos with really good assurance that at the time that we want to thaw them, they're going to work fine.